Good afternoon. I'd like to call the April 13th, 2015 Human Services Committee meeting to order. I'm looking for an approval of the agenda as printed on board docs.
So moved. Support.
We have a motion and support. Are there any comments, questions, additions, deletions to the agenda? Seeing none, all in favor of approving as printed, say aye.
Aye.
Opposed, the same. Next, we have public comment. Is there any public that would like to address the board? Seeing no public here at this time, which would like to address the board, we'll move on to committee items. First on the agenda, we have the minutes of the March 9th, 2015 Human Services meeting.
Support.
We have a motion and support of accepting those minutes as printed. All in favor say aye.
Aye.
Opposed, the same. Motion carried. Lifeway's monthly report. Mary Beth.
Good morning, Commissioners. This month's report, I will point out a few things related to activities that's occurring at Lifeways. First one is related to, we still, as you know, we did apply for the Integrated Health Grant through SAMHSA. We're still waiting to hear. They have reached out for additional questions from us, so I'm hopeful that that's a good sign as far as our ability to obtain that SAMHSA grant. The other thing that's occurring right now is we're looking at the capital improvement needs related to the roof repair and to the roof repair of our group homes, as well as some additional items around the need for a generator and some other capital needs. And we're working with the Jackson County Building Authority with our, as well as with the county's facility staff on coming up with a bond proposal back. So we will have something hopefully within the next month back to the county on that issue. We're just trying to pull all of that together into one proposal. The other update is related to our IT. As you know, we did lose our information director. We did reach out to our region to see whether or not we could get support temporarily for that, and that was not a possibility. We are and have contracted with an individual that has experience with the community mental health system, who will be providing some on-site short-term consultation as we move forward with doing an IT assessment of our structure and helping us with some recommendations for moving forward as to how to best meet the needs of the agency moving forward. And the other thing that's occurring is related to HAB waiver. As I talked about last month, that is a service that we are bringing back in-house, the management of that population, because of the critical nature of the needs of those people. And we are currently in the process of interviewing candidates, so that's where we are in that process. The plan is for implementation to begin July 1st. The other update that's in your packet is related to substance abuse service needs. We continue to be challenged with needing detox services, as well as looking at an alternative related to those individuals who are showing up at the ER who could be better served in what's called like a sober center versus placing them in the inpatient setting. So we are working with our coordinating agency and the PIHP to move in that direction. So I'm hopeful that they had indicated within 60 days, and it's been about almost 30 days now, that we will have a proposal back from them as to moving forward. And that will be great for our counties, because there clearly is a need for both detox alternatives as well as some type of sobering center for individuals. In your packet as well, I wanted to share some information about the fact that we are always looking at ways to manage our general fund dollars. And one of the things that we do is we look at individuals that are currently either in specialized residential placements or who are in state hospitals, and how can we work to coordinate and ensure transition back to the community successfully. And I wanted to share what the impact of that is, and you'll see that in your packet related to the financial impact as well as how successful. This is just two individuals who were in a state hospital prior and were not successful in the community. And we really looked at how can we work with our community providers to wrap services around these individuals so that they are successful. And you'll see that in the first case listed there, prior to the individual being successful in the community, our highest cost for that individual was $265,000 annually. And that's an individual who was in the state hospital. Our cost in 14 and 15 was at $98,000. That's a significant savings on our general fund dollars by being able to truly wrap services around that person and ensure that they're successful in our community. The other case that I shared was another example of an individual, again, who was in specialized treatment and who prior history was not successful in the community. Both of these individuals have been successful since 2013, remaining in the community, hospital-free, not having crisis intervention. They're even ending up in our crisis home, and it has had a reduction in our general fund dollars. The second individual, the highest cost was at $211,000 annually, and last year's costs were at $49,000. So that's a significant impact, and we continue to do that to really look at how can we ensure people are successful. So when you hear about the work that's being done to move people out of state hospital, that's why, because it's both, we can design services that they can be successful and it can create savings. The other thing that I wanted to point out was related to population health data. As you know, that is a movement that the state is expecting, in both nationally and statewide, related to monitoring the health of the population that you serve. And we are moving forward as a region with a product called Zenith that will allow us to be able to look at aggregate data, not just from behavioral health, but from physical health care, and be able to track those high cost, high utilizers of ER and other types of services so that we can really design services across physical and behavioral health to impact those costs and improve care. Law enforcement training, I wanted you also to be aware of the fact that we are looking at how we can coordinate with local law enforcement to utilize our intensive crisis stabilization team that we implemented over this past year. If you might recall, we implemented that in December. And we're looking at how we might be able to assist them with some of the challenging issues that they face out in the field in regards to individuals with a mental illness, and how we might be able to utilize this team that's a mobile team in assisting law enforcement as they handle these issues out on the road, out in the community. So as we know more and as we have further planning around that, we'll be sure to share that with you. Let's see, the other thing that I wanted to update you on was related to what's happening with the House, with the budget for community mental health. As you know, they did pass a supplemental, and that supplemental did increase the general fund level to the community mental health, both for fiscal year 15 and also projected, it's in fiscal year 16 budget. There are some things that are in the House and the Senate, some changes that could potentially have some impact on some service delivery related to the community mental health. And one of the big ones was related to the Wellness Commission recommendation about the development of a psychiatric residential treatment center for children. One of them reduced the planning for that to not even start until after 2016, and the other one reduced the funding for that. When we look at a region-wide, when we look at our needs related to individuals showing up in our ER, especially youth, there is a significant need for the development of a center like this, a psychiatric residential treatment. And so we're going to continue to advocate that they not cut that and continue to look at an opportunity to fund that for the state. The other thing that's in your packet talked about the impact about what's happening at the state and at the national level related to changing the funding. The House and both the House and the Senate are proposing that they convert Medicaid to a block grant. And why that's important, states need to be watching that, is because it does have an impact on funding. What that'll do is right now, Medicaid is funded based on numbers, enrollment, number of individuals in a state that are eligible for Medicaid. What will change if they move it to a block grant is it will be blocked is related to the funding level. And then moving forward, if your state sees an increase, whether it's because of economic reasons, and you see more people in need of Medicaid, your funding will not change as a result of that. And that could have significant impact on states related to being able to provide services, especially with Medicaid dollars. So from a perspective of the community mental health, there is concern about moving to a direction that it's block granted. So I wanted you to be aware of that. And then the other thing that is happening, obviously, that you're aware of is related to the DHS and the Department of Community Health merger. That's has occurred, and we are continuing, myself and Zoe, meeting to talk about what that will look like locally. As far as the impact, at this point in time, we don't really have a whole lot. We do know what that organizational structure looks like, and that has been shared from an overarching standpoint. And hopefully you've seen that. If not, I'll be happy to share that with the commission. But that's really where we're at this point in time. So I'm open to questions.
What comments or questions might you have for Mary Beth? Commissioner Rice?
I'd just like to make a comment pertaining to the psychiatric care for children, as well as people who need to go in for detox, either on their own or brought in by family member, or even brought in, or even brought in by law enforcement. I have several people in my network that I've worked with for years that currently work at Allegiance Hospital. They work in the emergency room, they work at the Anderson building, and quite frankly, there doesn't need to be any cuts, there actually needs to be increases. It's unfortunate because we just keep pushing people to general practitioners, which general practitioners are great, but they just don't have the overall knowledge on how to actually assess and evaluate what a child or adult needs in terms of medication. And I can tell you recent experiences with some friends of mine that I've talked with. They actually had to turn people away because they don't have enough beds, whether it be a detox situation. You get a detox person in the emergency room who's just flipping out, and then you got the people next door who are scared because that person's just flipping out and they have nowhere else to put that person. And then they try to find beds for these people, whether it be a psychiatric issue or a detox issue, and there's nothing available. So then they start calling other hospitals and seeing if they've got room, and then they call Allegiance and see if we've got room, and it's just not working well. So just want to throw that out there.
Right. And as I shared in prior presentations, it is challenging related to the inpatients for psychiatric services, both for detox and for psychiatric needs, and that we have had people sitting in the ER for up to 5 days waiting for somewhere in the state to have an opening. So it definitely is a challenge.
Thank you for that insight, Commissioner Rice. Mary Beth, in regard
Yes.
to when you say youth, what is the age of youth in this definition?
Well, for most of these, it can be anywhere down to the age of 4 or 5, as young as 4 or 5, who are in need of residential placement.
And at the high end, what is the
Is
age?
18.
18.
Yes.
Thank you. All right, thank you for that presentation.
All right, thank you.
Community Action Agencies, quarterly report. Toby?
Good afternoon. I just wanted to go quickly through my report that I submitted regarding the NSP program. Some things have changed in the last month since I submitted this. Actually, the date on here is incorrect, so I apologize for that. We have sold 6 homes. The house with the purchase agreement will hopefully be closing this week, so we will have sold 7 at the end of this week. 2700 Kibbe is now being listed today, so that the construction has been completed and it will be on the market. 121 Hall in Michigan Center, Habitat has identified an eligible home buyer, so they're moving forward with their sweat equity and finishing up the rehab there. We recently were donated a property from Wells Fargo Bank, 2317 West Franklin, that we will be working with Habitat to rehab. So we continue to move forward with the program. At some point in the near future, I believe HUD will be asking us to close out, and then we will just continue with program income.
Toby, on that home on Kibbe Road, you said it's just finishing construction. Was that construction also done by Habitat?
No,
Or- okay.
Kibbe was done by a private
Private.
developer. It will be listed today, actually. The listing's going up for $110,000.
Okay, so of the work, of the homes you're renovating, approximately what percentage are done by Habitat versus a private contractor, approximately?
Probably about a quarter. It's in order to keep, we have to spend 25% of our funds for people who are at 50% AMI or below. Those are
Okay.
very low-income home buyers, and we plan to do that with Habitat because that is also the income that they are required to meet for
Okay.
their mission. So it just worked better for us that they would identify buyers and move forward. So about 25%.
Okay, thank you.
We currently have $106,000 still under contract, slightly higher than that in program income. So we're moving forward with NSP. HUD is coming tomorrow for our monitoring, so we will be hosting one monitor for the next 3 days. So that's always fun. For CDBG, we are moving forward, now that we have expanded our target area, that was very helpful, and we've been able to move forward in getting more units in the process for development. We're projecting right now $131,000 additional dollars to be utilized for CDBG just from being able to expand that target area. So we appreciate your willingness to do that for us. Of note, though, we did attend a meeting, training with MSHDA in February, I believe, and they are really planning to kind of overhaul the CDBG program, and it may not be, we may not be able to use CDBG in the future for homeowner rehab. It may have to be used for rental rehab, and they will be utilizing other funds for homeowner rehab. So there's a lot of changes that are kind of happening. Nothing has yet come out as finalized, and once that does happen, we'll make sure that we work with the county to kind of let you know what that means and decide if it's something you want to move forward with. We can help facilitate that. And that's my report.
Commissioner Rice?
Hey, Toby. Actually, just a comment. It'll be interesting to see what happens with the current block grants as far as a rental or not, too. But
Right.
Yeah.
it'll be real interesting. But anyway, as far as 303 Broad Street, obviously you're familiar with the house that's being constructed right now. And you have, there's the other houses you have on Broad Street, obviously, I've been in a couple of them, as you know. Beautiful homes, and they're occupied, which is a wonderful thing. But the struggle I have with 303 Broad, I drive by it all the time as I go to my mom's house. And maybe I shouldn't have said that. But anyway, right next to it, as you know, there's a house that actually, the house is, it actually almost looks like a trailer right next to it. And you could actually be, when 303 Broad Street is done, it will look beautiful. But those people, whoever buy that, could reach out their window and touch that house right next to them. And I know that's something that I've been working on with the township about. I mean, that house now has gone down in value. They're asking for like a little over $9,000 for that house. I guess my question is, to me, what would be best served in that neighborhood is somebody would come up with a few $1,000s and just demolish that house and just open that lot up. Is that anything that you could help out with or not?
I can take a look at, I don't know what the circumstances are for the sale. Is it owner occupied or is it a foreclosure, and kind of what those things are, but I can take a look at it and see if there's any way we could work it in.
All right, thank you.
Yep.
All right, seeing no other comments or questions, thank you, Toby. Next on the agenda, we have Department on Aging. Region 2, Area Agency on Aging. I'm sorry, thank you. Hello,
Good afternoon.
welcome.
I'd like to start by introducing myself. My name's Julie Weatherby, and I'm the new Executive Director at Region 2 Area Agency on Aging. It's nice to see you all. I started January 9th as the Executive Director. I've been with Region 2 for 7 years, so I'm just in a different position, so glad to be here. I'll start by, I had sent a report which really shows the allocations we've made to Jackson County for the fiscal year of 2015, which it shows for each of the sections of allocations, the amounts. The total fiscal year funding for Jackson County contracted services is $889,271. And then we do not have the figures yet for 2015 for number of clients served, but we show the number of clients served for fiscal year 14. So the total funding in Jackson County, which includes all of our waiver clients, our Medicaid waiver clients, is $3,382,430. As of February 28th, we had 356 Medicaid waiver clients that were serving in Jackson County, and at that time, 39 care management clients. And I added a new box to our report, which we're just starting to do some more tracking at the agency on calls we receive. And for what we had recorded for 2014, we had over 754 calls from Jackson County residents for help and information, and we referred those calls to other Jackson County agencies, were 337 calls. And then we have some other contracts that we handle. One is for legal assistance, which is listed there, and the nursing home ombudsman is listed there. And then we also do a smaller contract for prevention of elder abuse. So total regional services was $69,614, which included the legal assistance, the ombudsman, and the elder abuse prevention grant. A couple other things I wanted to mention. We just heard about it, but the new Department of Health and Human Services, Region 2 Area Agency on Aging, is also affected by that new department structure. The combining of DCH and DHS, which is Department of Human Services and Department of Community Health, that all took effect on October 10th, which was last Friday. Unfortunately, we still do not have all of the details. We got the same organizational chart, which showed how things are being divided, but it's my understanding from talking to the former offices to services to the aging head was they're still working it out. They're still moving things in different sections of the organizational chart. When I talked to her actually last week and asked if she had any news I could share here, she did not really have anything, although she was hoping I would get like some type of an email today further depicting how that might flow to Region 2, but so far I have not received that. The other thing I wanted to highlight was integrated care, which in Michigan is called My Health Link. And what is happening is they are piloting integrated care around the state, and it's not in Jackson or Hillsdale or Lenawee counties, which are the 3 counties that we serve, but it is in some of our neighboring counties. So we are keeping our eyes and ears open to how that's working for those counties and actually taking advantage of some opportunities to learn about how that is working in the other counties. So there may be some networking opportunities that Region 2 can have with the surrounding counties to perhaps do some training with our staff and provide some help to meet the needs so that actually we can learn from the ground floor how that's working and then bring it back to figure out how it will affect our structure. And then I just kind of wanted to highlight for you that may not know, what kind of our mission is at Region 2, and it's to improve conditions affecting the lives of older adults in the region. And we do network with a lot of community partners, like, for example, Zoe at DHS. We've worked with her. We actually have an in-house DHS worker that is helping assist with the Medicaid applications for all of our clients. And we've seen a huge increase in information flow and shortening of the time period that it takes for a person to get on Medicaid, where before we had a lot of emails back and forth with workers in 3 counties, and our in-house DHS worker now is actually taking on the cases for all 3 counties.
So, Mrs. Weatherby, did I hear you to say then that was not done before, that that's something that is new, that collaborative effort between the 2 departments?
Yeah, it's a collaborative effort. We had to apply to actually get the in-house worker and worked with Zoe to make that happen, and that just happened in February, but already we can see an increase in the support to our participants to get their Medicaid issues and applications processed in a timely manner, because we just have one focal point now to go to instead of, several. So that is awesome.
Sure seems like it makes a lot of sense, doesn't it?
Yeah, it's really good. So, and we had heard that from other area agencies on aging around the state. They all, it was a goal of a lot of them to have an in-house DHS worker, and from talking to all of them that have it, it was definitely a heads up. Some even have more than one if they're a bigger, AAA. So I think that's really all the things I have, unless anybody has any questions.
Well, thank you for that report. Commissioners, any comments or questions? Commissioner Rice?
Comment again. I'd just like to, number 1, it's good to see you here. And number 2, I'd just like to say that the Region 2 AAA Executive Committee that interviewed many people for the position of Executive Director, they certainly made a very good choice.
Oh,
So-
thank you.
And I happen to be on that committee.
Seeing no other comments or questions, thank you for that presentation, and we look forward to working with you, and congratulations on your new appointment as well.
Thank you.
Now, how about County Health Department on Aging? Thank you.
Good afternoon.
Good afternoon.
On March 5th, there was our first fundraising event for Meals on Wheels, and that was culmination of a campaign called Soups On for Seniors, where letters went to businesses asking them to sponsor Meals on Wheels, and then the event itself that was held at Ella Sharp Museum. And I've included in the report a list of the businesses locally that donated to Soups On for Seniors, and then also the revenue from the event night. So there was a total donation of $11,800. And then the Friends of Jackson Seniors, they're the nonprofit entity that sponsored Soups On for Seniors. So then they have donated $12,000 to the Department on Aging for the purpose of helping to pay to replace a Meals on Wheels vehicle, a van, one of the vans. So we're just very pleased. This was the first time that, again, that we've partnered or helped another entity or do any kind of community fundraising for a program at the Department on Aging. And Meals on Wheels is the largest program that we provide So we're very pleased at how that worked out. And just to let you know, on April 21st, we're having our 5th department-wide training. So our sites will be closed that day. People will be getting their Meals on Wheels the day before for that, because we won't be delivering meals on April 21st, just so everyone, our meal transporters, our home care workers, our nutrition site leaders, social workers, office staff can be at this training. And it's held at the Human Services Building, 8:30 to 1:30. And then you have in your packet information about revenue sources for the Department on Aging. And so I just brought the slides with me here. Okay. So Department on Aging services support the healthy community component of the Board of Commissioners' strategic priorities, because we want to promote healthy living, help people remain independent for as long as possible, and do that through nutrition at different senior sites, exercise classes, Medicare, Medicaid assistance information, and then in the home, help people live independently by delivering meals, providing homemaker assistance, personal care, respite services for caregivers, and other programs. So then in 2014, this is a list of our revenue sources. So senior millage was 39%, and grants through the Area Agency on Aging, the Julie Weatherby just talked about, 37%. And then you can see the other components of revenue. Medicaid waiver pays for Meals on Wheels for Medicaid waiver eligible participants, and also some home services. And then clients, through the Older Americans Act, our clients are given an opportunity to donate for the services they receive. And then other purchase of service, for example, there's certain forms that we fill out for Medicare, Medicaid assistance program called MIPA, and then they reimburse us for each form. That's an example of a miscellaneous revenue. And then this chart shows where the money went, the budgeted, the expenses. So as I mentioned, the largest segment is for Meals on Wheels, and then second to that is home care, which is respite services. It includes caregiver education, which is someone talking to caregivers about what their options are, whether they're caring for someone who's older or maybe a child they're raising. And then geriatric mental health, that's Alzheimer's respite as well as counseling for homebound seniors. There's senior centers, our congregate meal sites, and there's 8 throughout the county. 2 of them are senior centers. And then social work is home visits. We meet with each senior who's receiving a service in their home. They're seen initially and then every 6 months for a review. We connect them with services that they might be eligible for. It includes caregiver information and assistance, people calling, asking what services are available for my loved one in your community, answering questions, Medicare, Medicaid assistance program, and then administration is also in that budget. And we have service priorities, and our top ones are in-home services, Meals on Wheels, personal care, the list that you see there I've already mentioned. Gatekeeper is a program where someone calls and says, I'm concerned about my neighbor, I'm not sure they're taking care of themselves, I don't think it's an adult protective services referral, but I would like someone to talk to them. That's what we call Gatekeeper. Chore in-home are installing things like grab bars, stair rails. Alzheimer's respite for people caring for someone with dementia. And it could be an out-of-home option, maybe someone's going in for surgery and we will pay for the loved one to be cared for in a local nursing home while the person is having surgery. That's just an example. Our senior sites, counseling, coping with grief and loss, the Medicare, Medicaid information, caregiver information and assistance, and education support, and then our senior sites. So that's kind of a list of what our priorities are. And this was from a survey 2 years ago from staff and Advisory Council on Aging members. So any questions about?
What comments or questions might you have for Marcy in regard to the presentation? I do have a question, Marcy. It's not necessarily for you, but maybe Administrator Overton or Deputy Administrator Brown. On the first document she shared, Marcy mentioned the staff training, and she states here that this is their 4th department-wide training associated with the high-performance organization concept of moving from good to great services. And I personally find that impressive. I find Marcy's leadership on serving on the SIT team, and she sets a high bar in service-related performance from her department. I'm curious where other departments stand in relationship, if that's their 4th. They're obviously moving forward and doing a great job with providing even better services. Just wondering if you could give me some insight there.
Couple things, and Adam, feel free to chime in, of course. First, I would say that Marcy is probably at the top when it comes to HPO. Not every department now. You know, the health department clearly is also up there, but again, there's some departments that, dare I say it, do not participate in HPO. They have another means or system they're using. So generally, that's those individuals, those are other elected departments that they report to. Obviously, administration, they do participate. But no, she definitely does. And you know, in addition to that, I would add that perhaps people don't realize the value that the Department of Aging provides. I know it goes, you know, people just don't think about it. Well, which is the problem with a lot of seniors. People don't think about them either, you know, especially if they don't have family. But the cost, and I bring it to cost, but the truth be told, we save a ton of money in the long run by funding this program here. Not every county does. We're ahead of the curve in that. So it really makes a big difference in the long term. Think of the cost, what it takes for a senior to be cared for in a home, or in a hospital, or in any institution, compared to living in their own home and the services we provide. So it's a much better quality of life, in my own personal opinion as well. But no, to be commended for sure.
All right, thank you.
Thank you. And I do have a thank you note from one of our older adults that we're helping out. Dear Department on Aging, I just want to let you know you have been a great service to me, and I appreciate your interest in me and my needs. I really want to thank you for all your services, which have really helped me in every way. I especially like having my Meals on Wheels because they give me the portions of food I need in the most nutritionally balanced way, which I am not able to do or afford on my own. Please keep up all the good work you and your staff are doing. So, thank you.
Next on the agenda, we have the Health Department. Good afternoon, Richard.
Good afternoon, Commissioners. Good to see all of you again. My report is, of course, in your packet, and I just want to highlight a few things that I noticed some updates could be done on. Ebola preparedness and I guess response continues at the national level. We've seen some progress in the West African countries that are most affected by the Ebola virus disease and the infections. But I kind of point out that at the national level planning, planning at the national level, if you will, has now kind of moved a bit forward in terms of identifying that preparedness and response to Ebola is entering a maintenance phase now. We're not going to decrease our readiness in any way. We're going to be prepared to respond to this. We've been lucky in Jackson County that we haven't had anyone here in the community that actually needed to be monitored as a result of being exposed in one of those West African countries or having the positive travel history. So we're not dropping our guard, let's put it that way, with respect to Ebola, because it's still a significant threat. Relative to that, we did receive a small amount of funding in what they're referring to as Ebola Phase 2 funding. It's about $17,000 that we can use internally in the Health Department to continue to add resources that we might need. I know that my most recent conversation with some of our staff and our emergency preparedness coordinator was that, gee, an awful lot of our personal protective equipment that staff nurses might need to use to respond to this are getting close to or already expiring. So this was very handy to have these resources come in at least for that. But we also could use it for training and other things that we might need to do. We do have periodic assessments of a number of public health emergency preparedness related plans. The SNS, or Strategic National Stockpile Medical Countermeasures Plan, is one of those, and we usually have this take place every year through a technical assistance and a review visit, and we've continued to perform at the 100% level for that particular plan review, so we're very pleased with our scoring on that. I also included a chart in my report regarding the essential local public health services funding over the past approximately almost 10 years at this point in time. From 2003 forward, and it goes through 2015. And I guess the only thing we wanted to say about this is that if you have an opportunity to advocate with our elected officials about essential local public health service funding, please feel free to do so. As you can see from this small chart here, if we had kept pace just with inflation, the overall amount of additional resources that would flow to local health departments across the state would be $11.8 million. 50/50 cost sharing has been in place in the public health code for a long time for these particular services, and right now the relationship is about 30% state and about 70% local. So unfortunately, the language also indicates that the resources are provided based on funding availability, so it's not an automatic guarantee. But anyway, anything we can do to help reduce that impact on our local budget would be most appreciated. We've done a lot of work, as you can see, over the past year or so with health integration efforts with Allegiance Health, and I want to highlight a few things there. You've probably heard me talk a number of times about the provider survey on behavioral health diagnosis and how providers are effectively managing and caring for their patients with these disorders. We did finally complete the final report of the survey that was done last year and ended in November. And from the report, you can see what the key next steps are. And I'm pleased to be able to say that we had a meeting last Friday and are moving forward with Allegiance and the Behavioral Health Unit on a number of these items. I don't think we know exactly what direction we're going to go yet or how we're going to get there, but I think it's good progress. And we're looking forward to also doing another survey of the mental health professionals in the community with the Behavioral Health Action Team of the Health Improvement Organization. So we're covering all the bases here and understanding the system barriers that may exist out there in the community to doing a better job of caring for those patients in Jackson County. We also finalized a report for lead testing, screening, and elevated blood level follow-up with the Jackson Health Network. And we identified 4 particular items there that we're going to work on and we're moving forward on. We found out that we have the ability to import weekly lead testing results that are received by the health department in spreadsheet form directly into electronic medical records. That was a great outcome because what that's going to do is help providers to be able to know right up front whether a child has already been tested, so we don't test them again. They don't need to be tested more frequently than is necessary. We can develop and approve a lead testing metric in the quality measures of the JHN. We're hoping that we move that forward so there's a way to establish a baseline and a benchmark going forward within the Jackson Health Network and the providers. We plan to upload scanned clinical notes and discharge summary information directly into the EMR as well from the health department so that we're keeping everybody well informed, including the individual healthcare provider. And we also want to establish what I'm describing here as an auto notification function, but it will probably be established more as a task to the provider's EMR inbox and become part of the provider approval queue. I know that's a lot of medical legal terminology there, but the bottom line is we want the providers to be able to see when a lead result comes in to their provider queue and it's 5 micrograms per deciliter or higher, they know to task us at the health department to do the investigation. It's that simple. That's what we're trying to accomplish. A lot of work has been done on the state innovation model planning. I expect that Dr. Schultz will probably be finalizing this capacity assessment for the accountable system of care this week. I think we have another meeting on Thursday, but I think we're pretty close to having that particular piece done. And there will be another capacity assessment probably coming out toward the end of the month, first part of May, if you will, on the Community Health Innovation Region. And the Community Health Innovation Region is our health improvement organization here in Jackson. So we're we're excited about that. Dr. Schultz also worked with a few of us in the community to apply for a Spreading Community Accelerators Through Learning and Evaluation grant, which is supported by the Robert Wood Johnson Foundation. And SCALE, as it's better known, is to support local leaders at every level of a community to be successful and to multiply basically our health improvement efforts. The HIO was only one of 57 finalists for that particular grant, and the only one in Michigan, by the way. Under Community Integrated Resources, we've done a lot of work in this area. What I can report to you at this point in time is that the monthly health awareness topics that I have on page 4, that calendar has now been finalized between the Health Department and the Jackson Health Network. So we looked very carefully at, okay, what are the quality measures that are in the network that we want to emphasize, that are high-risk conditions in the community, that both we and the network can agree upon are health improvement topics to focus on. And we were able to do that, and I'm really excited to indicate that the month of May is the first month that we're focusing our efforts together, both at the community level and at the patient and provider level, with World No Tobacco Day. So materials have already been developed for both of those, and they'll be going out to the practices probably first part of May. There's some other updates and things I try to keep you updated about. We're still talking about and trying to figure out how to form a health access coalition within Jackson County. And I think that I've talked about this previously, and it's really about having a way for the healthcare system, if you will, to come together with the Public Health Department and other interested members of the HIO to talk about if we're planning on changing a service or deleting a service that exists in the community. And there may be legitimate reasons as to why an existing organization might choose to move away from providing care of one nature or another. But what we want to do is come to the table and talk about it, because the impact oftentimes can be unintended consequences, and we want to make sure, for instance, if we're going to close something like Express Care, we know what that means in the community. So that's just one example. So we continue to work on that. The immunization forum I've talked about previously, we're going to have a first kind of a kickoff meeting on May 15th, and that's going to be a smaller group that really looks at the structure and organization of this immunization forum and reach some agreement on what the goals and objectives would be, and then we will do a broader invite as a result of that. Population health measures, we've done a lot of work on that, and right now we're trying to align what has been developed with the Jackson Health Network through the strategic planning process that the JHN is currently going through. So that seemed like a good place to do that. We did have a norovirus outbreak in March. It was at one of our long-term care facilities in the community. A total of 44 residents became ill, and we had 35 staff there as well. So norovirus is one of those that spreads very rapidly and quickly throughout a facility, and it's often difficult to get ahead of it and to control it and eliminate future infections. But they usually are self-limited and run their course. Guidelines and precautions were provided always by the health department, and as of probably end of March, restrictions were lifted. We're continuing to focus on the immunization status of school children in Michigan. Our waiver rate, if you will, for immunizations for kindergarten is less than the state overall. We actually do pretty well. 3.5% for Jackson County overall, and in the child care centers 2.7%. But those waivers and waiver rates and immunizations in general are exactly the kind of thing we want to talk about in the immunization forum. So we want a community approach to it. We got a very nice donation from the Rotary Club for immunization outreach and support. It was a total of $5,000. We've already developed a plan for outreach and education, if you will, related to that with the Rotary Club, so we're really excited about that. Under influenza update, my report indicates we were in regional flu activity during the week of March 16th. We're now at local activity, and we are wanting to work with county administration and the wellness committee to actually do a survey of all county employees to find out how many have actually received the flu shot, because we think it's important information for us to know. It does reduce absenteeism, increases productivity, and helps reduce the respiratory illness level in the community. So we're planning to do that with Mike's help. As you're probably aware, we do a lot of application assistance in the health department, and I can point you to that particular paragraph on page 6 of the report. in terms of the kind of assistance that we provided to residents in the community. We did health insurance applications and enrollment for 103 people, but as a result of going through that process, people often are able to be identified for other kinds of supports that are available through the state system as well. We did a free car seat check event on March 25th, and that went very well. They're very well attended. The Teen Pregnancy Prevention Initiative had their Power of Me fashion show in 2015, which was a huge success. And I won't go through that in detail. I think you can read what was accomplished there. One item on the back of, on page 7, the federal grant application to the Office of Adolescent Health. We had a few, I guess I would call them electronic glitches between us and the Wayne County's Alternative for Girls Incorporated submission of the proposal. We're hoping we can iron those out with the Office of Adolescent Health, and they'll still accept the application. Unfortunately, sometimes DUNS numbers get mixed up with authorized organizations, and sorting that out sometimes can be a little bit difficult, but that's basically what happened. Rhonda Rudolph is engaged in providing the Reducing Underage Distracted Driving now in the schools through the spring, and her target is a total of 6 schools within the community, and it started last week in the Western School District. We have been working also in environmental health, the self-assessment, another one of the assessments that we do, the non-community water supply program for fiscal year 2014, and we satisfied all the requirements of that particular assessment, and we are in compliance with minimum program requirements. We're working with the Jackson County Conservation District on planning the 2015 Household Hazardous Waste Collection event, and we've had some interaction with DEQ in a fuel oil release cleanup site in a residential house in Munith. So we've been very busy. I'll defer on the animal shelter to Don since he's here today for his quarterly report, and I can give you a quick update on what the health department has been doing with HPO as well. We've been addressing the components and elements of HPO in our general staff meetings for 2 years, and we continue to do so. Our most recent effort is actually, we surveyed staff to find out where we as a health department are at in terms of achieving system level 4, which is way to the right where we want to be, and so we're in the process of evaluating and putting the report together on those results. Yep. So that's everything I have for you.
Before we move on to animal shelter, Commissioner Placzek?
Hey, Richard, how are you?
Hi, John.
I've got a couple of questions for you, going back to the Ebola to begin with. You know, it was a major concern for a long time. Everybody was worried about it. Now things have seemed to quiet down quite a bit. And I'm wondering if that's because of some training that has taken place to reduce the outbreak, or is the risk just less than it was before? Are people just caring less? Or is it just that it hasn't affected the U.S. and so we forget about it?
Well, we haven't, we haven't. Well, I think that they feel that the actual origin of this particular virus was probably in primates versus insects. So it's not? No, there's no evidence that it's transmitted by mosquitoes. None whatsoever. I don't think it's because people are less vigilant about it. We have a well-organized system in place in the country now that monitors people coming from the affected countries through international travel. And I think it's taken a little bit of time to work out the bugs in that system, but the reality is that there have been well over probably 120 to 130 people coming back from West African countries to Michigan that have been monitored successfully without any problems. The reason this tends to drop off the media radar screen is because we may not have anybody who's actively infected going to a U.S. hospital for care and treatment. That's when you tend to see the media increase coverage of that particular event. But for the most part, I think that we've done a really good job in the country nationally in identifying a way to control its spread here in the U.S. And obviously, the bulk of the work that needs to be done is to control and decrease the outbreak down to a manageable level in West African countries. And I think the training has helped too. We've had training here in Jackson County. We have worked together with Allegiance Health most recently in their full-scale functional exercise involving the influx of an Ebola patient. So you probably are as aware about that as I am, and we participated in that with another 5 agencies in the community. And I think it went really well. Our protocols and our plans seem to be appropriate and written well for responding.
Refresh my memory, but we've not had a contracted Ebola virus inside the continental United States at all.
Correct.
Have we?
Correct.
Well, then we're not preventing all we're doing is containing it within Africa. We're not preventing it from spreading here.
Well, and unless we're going to shut down international air traffic, we won't be able to prevent potentially people coming to this country who might be infected. We've got to be able to respond to them in the event that they do. And secondly, the people who have come back from Africa with infections have been successfully cared for in the U.S. So no, the transmission isn't occurring in the U.S. because we have a very good healthcare system and we know how to monitor people and assess them for any development of disease, which is where we want to keep it.
Commissioner Placzek?
Well, just one more question, Richard. You didn't report out on any positive TB during this reporting period. I take it that there just were no conversions done?
Yeah, we have probably only 1 or 2 TB cases per year that fall into the active category. And so we may see quite a few more people that are actually tested positive who are in the status of latent tuberculosis, and they simply are able to be managed effectively on long-term drug therapy, but they're not infectious. Yep.
Great. If there are no other questions for Richard, we'll move on to Health Animal Shelter. Don?
Thank you.
Thank you.
Thank you very much, Commissioners, and good afternoon.
Good afternoon.
Looking at the report, you'll notice that probably the first 3 bullet points are heavy toward Friends of the Animals of the Jackson Area Incorporated, and I definitely want to bring special mention to them because they've provided in the past quite a bit of support for the animal shelter. They're continuing to give some support currently as well as into the future. Along with the Friends of the Animals of the Jackson area, we also have a couple other facilities. Very recently, about 2 weeks ago, which I have not put into this report, but TAC Manufacturing, TAC, stepped forward with a substantial donation. And as well as Dave Klein has also provided a lot of support. So I would just like to make sure that everybody understands these 3 entities, individuals, very big supporters of the animal shelter. And with that, one of the things that the Friends did do was continue the support for the Spay-Neuter Community Cat Project, and by providing $3,000 in the first quarter. Now that helps defray some of the medical costs of the 200 plus or minus cat surgeries that our veterinarian does on a yearly basis at this point. It's directly related, we believe, to the declining intake numbers of cats into the shelter over time. This is not just Jackson County Animal Shelter performing these type of functions, but Cascades takes part in it, area veterinarians take part of it, as well as elsewhere across the state and the nation. The concept is community cats. I think we all are well aware that they exist out there in the neighborhoods. No specific owners per se, other than the ones that are providing food, maybe some shelter under their deck or what have you. But at some point, a neighbor or a resident may get fed up with the cat, as it has a litter or 2 every year. And so those are prime candidates for this project, where they're bringing in a cat with kittens, because I'm done feeding this cat. I don't need 15 cats running around my house. We will work with them to actually spay and neuter all of those cats if they will take them back to their place of residence. And that's how the program essentially works. And it's been ongoing, as I say, not just by us, but the veterinarian community at large. And so Friends helps us defray some of the costs, because there's medical supplies, there's time, there's effort involved. We also have, in January, placed a new outdoor privacy fence exercise yard in place. That did occur in January. Wasn't the best of weather, but it was installed, and we are currently using it. It's going to be a grassed area. We're going to put a picnic table back there along with some other lawn furniture. Not a whole lot, but it's going to be a prime area for meet and greets between potential adopters and their own personal pets and a potential animal shelter dog, so that we can determine, without leashes, in kind of a semi-unconfined area, are they going to get along? That will help the adoption process. And Dave Klein was one of the donors to help make that happen. Then we are also in the process of doing some remodeling to the cat room. Right now, we're trying to increase our cat colony structures from 1 to 4. Facilities did a wonderful job of prepping that area. We're just waiting for the cage front or the stall fronts to arrive from Mason Company from Ohio. And that's going to create an environment where multiple cats have more room to jump around, less stress equals less higher immune system, which means less infection. That's the theory on that one. One of the things that we are thinking about, and it's an idea that has been rattling around in my head for a while, is actually creating, having a plaque of some sort to be installed in the front lobby for some of these major donors, just to give a little bit of additional recognition. Get that in the front lobby. And obviously Friends, TAC Manufacturing, which has been an ongoing donor through the years, I've noticed, as well as Dave Klein would be obviously likely candidates for for recognition on that plaque. With that being said, I would like to bring to everybody's attention Friends of the Animals 25th Annual Bowl-O-Rama, or Bowl for the Animals. It's happening on April 25th. That's one of their major fundraisers of the year on a yearly basis, and we do benefit from some of those proceeds. So, friends and family, neighbors, get out the megaphone, couldn't hurt. So, as you know, late last summer we did install a new software system, Chameleon Software Management. It's basically a case management system to keep track of every dog and animal that comes through our doors. It is really proving to be beneficial. It's a better tracking system. Provides our staff with easier access. And the interface between the medical side as well as the floor operations side has just been a much more efficient process with better communication. And that's when we're trying to get medications into any particular animal, verifying that it actually did happen. So the whole system is a definite upgrade, and we're real happy with that. I've also attended the monthly police chiefs meeting in the March meeting to discuss a few things. One of the items is access for the outlying police departments. That has been somewhat of a problem from time to time. For instance, Spring Arbor back in January had a dozen dogs to bring in from a cruelty neglect situation, and it did take them a while to make contact with the sheriff's department, get the access card and a key. Not every police department has that at their disposal. So with that being said, we are globbing on to the police chief's school project, where every school in the county is getting what's called a Knox box. We will also have a Knox box. We're going to have to pay for our own box because we are not part of the actual grant. But every police cruiser and officer will have access 24/7 within their car. They're not going to have to go back to the sheriff's department or anything along those lines. So that's moving forward as well. I think the police chiefs are happy with that. Speaking of those dozen dogs, I do make mention of that. We are actually we have a few cases here of neglect, cruelty. We tend to be the place where those dogs and cats do come in. So one of the things is sometimes they get into a holding pattern. And We can be hanging on to these animals for months at a time, waiting for the court situations to resolve itself. So we actually are trying to enter into some discussions with the police chiefs as well as the prosecuting attorney to kind of expedite that process, determine a more streamlined approach, so whereby we are gaining ownership of the animals in certain situations, the communication opens up a little quicker. Are they going to prosecute a particular person or not? That would also play into the equation. So we're starting those discussions. The goal is basically to move the dogs and cats out of the shelter as soon as possible and not be in there for 1, 2, 3, 6 months at a time. When I first came on board here, we had 3 dogs that had already been in the shelter for 9 months as a pending court case because the owners fled to Ohio. And it was another 3 or 4 months before that was actually adjudicated and resolved. And then ultimately, the court order was to euthanize those animals. So we spent a good year, plus or minus, of housing these animals to just euthanize them in the end. So we need to come up with a better system, and we're working toward that goal. We also participated in a Tractor Supply Company adoption event end of March, and it was pretty successful, one of the more successful ones that I've come across. We actually had 6, and actually I would probably say 8 applications of animals actually getting adopted out as a direct or indirect result of that event. It was over the course, we participated in 3 of the 4 days. We intend to do this again. We have done these events in the past, and we're going to be taking part in the Cascades annual spring fundraising event as well, which we participated in last year. And then coming to our final numbers, as you can see, when I provided you, some of our intake numbers for cats are down a little bit. Dogs were about the same for the first quarter. One thing I will say is I did make a little mistake concerning the euthanasia numbers for 2015. And for cats, the actual number should not be 43, it should actually be 79. So our euthanasia rate did go up in the first quarter. I attribute that to the fact that our renovation to the cat colonies, our capacity to have cats, came down for the past couple months, waiting for these cage fronts to come in. And so, unfortunately, euthanasia did increase for that. The dog numbers went from 36 to 42 for euthanasia. In reality, that's about the same. Our adoption numbers were down a little bit. I kind of attribute that to the cold weather. It was dang cold this winter. I'll grant you that. So, with that, I will open it up to any questions that you might have.
Commissioner Shotwell?
I have a couple for you. One, the Tractor Supply. I was there Saturday, and when you mentioned six applications, that's people that completed and actually animals went away from us? Is that what the deal is?
Yes, 6 to 8, probably closer to 8, I think.
Because I know there was a lot of applications filled out. That's why I was asking. I think while we were there for the hour and a half, 2 hours I was there with them, they probably took 30 to 40 applications for the puppies and the things that were there.
Well,
That's why I wondered.
Yeah, the puppies were the big draw, I'll tell you that, and there's no doubt about that. And the majority of those applications were the puppies, say 25 of those were for the puppies. We only had 6 puppies. So, again, so yeah, 6 to 8, 6 to 10 animals were probably adopted out because of that event. And we were there 3 of the 4 days. And let's see, probably Friday was the day we were not there.
Okay, and then I was approached on Saturday along with Commissioner Alexander by a city resident wanting to know, is there an opportunity for people who cannot afford spay or neuter of a dog for them to get assistance in some way to get the dog spay or neuter because they don't want it to, produce or run amok or that type of stuff, be the father of a couple litters or something like that, or a female that they wanted to have fixed.
Well, that's certainly a discussion we can have. Currently, we don't have a situation like the Community Cat Project for dogs. So it's something perhaps we need to discuss in the future. I would like to have something like that. Again, it comes down to funding and whatnot, so.
Now, I also noticed that when you do the math on intake minus adoptions minus euthanasia, you still have quite a few cats left.
Yes.
What do we end up doing? Do we end up eventually either adopting or,
Well, we also, there are several outcomes available. We actually do quite a few transfers to other facilities. We often do that sometimes for behavior, because other facilities are a little bit more, have a little more staff to deal with specific behaviors and can work with them more on a daily, individual basis. For instance, what you don't have there, I actually have the numbers. We actually transferred 53 cats and kittens out to other facilities, licensed facilities, for instance. We also do a little bit of fostering if there's some medical issues or some other special needs associated with some of these animals. So one cat went out to that. One cat was returned to the owner, one. Of course, let's put that in perspective, only 20 were returned to owners in all of 2014. For dogs, 42 dogs were returned to their owners, and that's a little bit more indicative. For some reason, dogs, we can get about 20-25% of the dogs returned to their owners. Something like 350 plus or minus were returned last year, for instance. And 35 dogs were also transferred to other facilities. And we work with rescue groups too, and we'll sometimes get fostering out there, or they will actually adopt out for their stocks.
Commissioners, any other comments, questions? So, Don, you mentioned the conversation you're having with township law enforcement officials. Do you believe then, in your professional opinion, it's moving in the right direction, that meeting was successful, and that you're addressing their issues and concerns?
Yes, I do think it's moving forward, and actually, we're addressing my issues, to tell you the truth. That was, I've always kind of recognized that access was a problem for the outlying townships. And so when this, the education grant, public school Knox Box program came up, and I'd like to thank Commissioner Elwell, because he's the one that kind of brought it to my attention. The light bulb went off instantly. Well, let's glob onto that. That makes complete sense.
Right. However, though, the criteria that you're mentioning here is not anywhere, does not meet the grant criteria. Those are completely separate, but it's the same conversation to take place and expand it to the next level.
Yes, it's going to have, well, what we're doing, I'm spending the $300 to $400 for the box itself. I will put an access card in there and a key in there, and all the police it'll be keyed exactly the same way as all the public schools. So it's not a separate key for the police. It'll be the same key that they have for all the schools. And that's the key, excuse the pun.
Okay. Thank you for that information. Seeing no other comments or questions, thank you.
Well, thank you very much.
We will move on to claims. March 9th, 2015 claims are in front of you. Look, we have a motion and support to pay those claims. All in favor say aye. Opposed, the same. Motion passed. Other meeting minutes in your packet as well. We have 3 DHS board minutes for your review. In addition, we have the May reporting schedule and May, DOA, Health Department, Lifeways, and ME. Some good acronyms here going. Next up, we have public comment. Is there any public that would like to address the board? Seeing no public comment, is there any committee member or commissioner comments? Seeing none, we'll adjourn to the call of the chair.